Patient Zambrano. Patient Zambrano.
Yes, ma'am.
Hi ma'am, good morning. My name is
Morning
Nikki
po.
Reyes and I'm going to be your red tech for today. Can I have your full name, ma'am?
Zyril Marie R. Cebuano po.
Okay, hi Miss Zambrano. Ma'am, ask lang ako pa-confirm sa middle name ninyo.
Reyes po.
Okay. And ma'am, kano sa man imong birth date and kano sa man imong birth date and pila na ang edad nimo karon?
On ma'am, March 8, 2000 po, tas 21.
Okay, 21 na ka. Ma'am, unsay preference language na to para mas comfortable ka?
Nakasabot naman po Bisaya, ma'am.
Okay. Sige, ma'am, Bisaya na lang ta. So, ma'am, kano sa mga last bidugo?
Last week, ma'am.
Last week pa. Ma'am, naa kay request ni Doc?
Kani man to, ma'am, no?
Oo, ma'am, sige. So, ma'am, noon sa day ka, ma'am.
Right. Na tagak mo ko sa agdanan, ma'am. Tapos akong dali o ang
Okay. Sakit diha, ma'am, no? Sige lang, ma'am. Kay, nakita naman ako ang request ni Doc and na-confirm na ako tanan. Ma'am, bali mag-ilis na tag-patient ka dito sa kilid na ilisanan dito. Balik na lang, ma'am, if kumana ka, ha? And also, ma'am, pa-remove ko sa mga metallic objects naas na naakaroon sa imuhang body. Ha, ma'am, ha? Salamat.
Yes, ma'am.
Sige, ma'am.
Ay, ma'am, wala akong ilis, ma'am.
Okay, ma'am. So, naka-patient gown na ka, ma'am, no? So, ma'am, sige, ma'am. Proceed na tayo. Dire, mag-position ka, ma'am.
Sige, ma'am.
Oo, ma'am, diha. Sige, ma'am. Position na to, ha? Kada lang. Ay, sinte ka, ma'am. Okay, ma'am. Magbutang ko shielding, ma'am, ha? Okay. So, ma'am, i-position ti ka, ma'am. I-follow lang ko instruction sa imo, ha? So, mag-move ta gamay diri, ma'am. Okay ka na. Okay. So, ma'am, I hook, ma'am. Kana, tama ka na, ma'am, ha? Sige, ma'am. Relax lang yung mga kamot, ma'am. Magbutang ko marker. Okay. So, for the central ray, CR is directed or perpendicular to IR, directed to 1 inch inferior to coracoid process. Okay. So, anak, ma'am, ha? I hook, ma'am. So, mag-collimate na ko. Okay. Okay, ma'am, humanata, ma'am. Pwede na ka mag-ilis sa patient gown, ma'am. Balik lang diri, ma'am, for instruction para sa pag-claim nimo sa result. Pwede na ka mag-ilis, ma'am.
Ma'am, humana ko mag-ilis, ma'am.
Okay, ma'am. Sige, ma'am. Balik na lang diri, ma'am, after 2 to 3 hours. Kay ka na ang releasing of results. Humanata sa atong procedure, ma'am. Thank you. Okay, sige, ma'am. I-position ka, ma'am. Magunit ko, ma'am, ha? Okay, so move lang tagamay diri. Ma'am, buhat akong buhaton, ma'am, ha? Kaya nga ano yung mga kamot. Kana. Sige, ma'am. Okay. Move kamay. Idikit ang body, ma'am. Kana. Sige, ma'am. Okay, collimate na ko. Ayaw lang lihok, ma'am, ha? So, in collimation, we should include or or the center ray should be perpendicular to IR, directed 1 inches or 1 inch inferior to coracoid process. So now I'll go and collimate the anatomy of interest. Ma'am, I will ma'am ha. Mag-shoot na ko. 1, 2, 3. Shoot. Okay, ma'am. Humana ta, ma'am. Pwede na ka mag-ilis sa patient gown, ma'am. Balik lang diri, ma'am, for instruction para sa pag-claim nimo sa result. Pwede na ka mag-ilis, ma'am.
Ma'am, humana ko ilis, ma'am.
Okay, ma'am. Sige, ma'am. Balik na lang diri, ma'am, after 2 to 3 hours. Kay ka na ang releasing of results. Humana ta sa atong procedure, ma'am. Thank you. Evaluation criteria. For anatomy demonstrated, in lateral view of proximal humerus and lateral 2/3 of clavicle and upper scapula is demonstrated, including the relationship of the humeral head to the glenoid cavity. For the central ray perpendicular to IR, directed 1 inch inferior to coracoid process. For patient position or part position, make sure to position patient to center of scapulohumeral joint to center of IR. Abduct arm slightly and internally rotate arm until epicondyles of distal humerus are perpendicular. For the SID, we will be using 40 inches, and for the IR, we will be using 10 by 12. Make sure to collimate on 4 sides with lateral and upper borders adjusted to soft tissue margins. Okay, ma'am. Magbutang ko shielding, ma'am, ha? Okay. So, ma'am, i-position ti ka, ma'am. I-follow lang ko instruction sa imo, ha? So, mag-move ta gamay diri, ma'am. Okay ka na. Sige, ma'am. Relax lang yung mga kamot, ma'am. Magbutang ko marker. Okay. Central rays directed to mid scapulohumeral joint. Approximately 2 cm inferior or slightly lateral to coracoid process. Okay, ma'am. Steady lang. I glihok. Mag-shoot na ko. 1, 2, 3. Shoot. Okay, ma'am. Humana ta, ma'am. Pwede na ka mag-ilis sa patient gown, ma'am. Balik lang diri, ma'am, for instruction para sa pag-claim nimo sa result. Pwede na ka mag-ilis, ma'am.
Ma'am, humana ko ilis, ma'am.
Okay, ma'am. Sige, ma'am. Balik na lang diri, ma'am, after 2 to 3 hours. Kay ka na ang releasing of results. Humana ta sa atong procedure, ma'am. Thank you. Evaluation criteria. Anatomy demonstrated. The proximal 1/3 of the humerus and upper scapula and the lateral 2/3 of the clavicle are shown, including the relationship of the humeral head to the glenoid cavity. Make sure to collimate on 4 sides with lateral and upper borders adjusted to soft tissue margins. Again, for central ray, it should be perpendicular to IR, directed to mid-scapulohumeral joint, which is approximately inferior or slightly lateral to coracoid process. For the technical factors, we will be using 40 inches for the SID, and for the IR size, that would be 10 by 12 inches. So, position patient to center scapulohumeral joint to IR. Place patient arm at side in as is or neutral rotation. Epicondyles generally are approximately 45 degree to plane of IR.